Artesunate comes from a family of drugs known as artemisins that are established anti-malarial agents. These drugs have been used for more than 30 years to treat millions of malaria patients worldwide. They were initially discovered following a research project initiated by the Chinese government in the 1970s and come from a herb, or plant rather, used in traditional Chinese medicine called青蒿or sweet wormwood. They have been found to have an excellent tolerability profile when used in malaria patients. But now we're going to be doing further studies to see whether or not these drugs might also be effective in the treatment of cancer. So at St. George's, we are planning to run a phase 2 study of artesunate given to patients with colorectal cancer 2 weeks prior to their surgery. The reason for this is because over the last 10 years, there has been over 400 different publications on the anti-cancer properties of artesunate or artemisins that now require further investigation in patients. We conducted a phase 1 study at St. George's, which was reported in January 2015, in January this year in eBiomedicine. And this was a phase 1 study, so it was a small study and it involved 23 patients. But we basically randomized half the patients to receive artesunate and half the patients to receive placebo. The drug was well tolerated, and in actual fact, in the patients who received the artesunate, we saw only 1 cancer recurrence at 42 months, whereas in the patients that received placebo, there were 6 recurrences. We therefore feel that this is obviously an area that requires further investigation to confirm if indeed artesunate can reduce the risk of recurrence in operable colorectal cancer.